All right, looking at salad, the salad technique, the objectives that we're going to talk about here. I'll go through the salad technique and then we'll take a quick break. We'll finish up here after the break. So the salad technique, we're going to gain a better understanding and familiarity of the salad technique, review the the indications of the salad technique, and then look at the steps, required equipment in order to be able to complete the technique. So what is salad? Salad is a mnemonic and it does suction assisted laryngoscopy and airway decontamination. So we're trying to get the patient suctioned out and make sure that their airway is decontaminated so that we can hopefully get them intubated more successfully. So one thing that I do want to just kind of remind you is we're talking about the salad technique or any of these things. This was a product that was produced by a gentleman named Dr. James DuCanto. We are not recommending that you guys go out and purchase this stuff. We're just trying to give you the information so that you can research it further and make a decision based on you and your medical director what would be the most appropriate for your agency. So as I said, this was developed by Dr. DuCanto. He developed a salad training mannequin and a large bore rigid suction that can be left in place during intubation. So what happens here is ideally the patients who are actively vomiting, and we know that this can be a problem, should be placed in the lateral recumbent position. However, if you are the one trying to do the intubation, the lateral recumbent position isn't going to be the easiest thing for you to do. So what is the alternative? If you can use one of these devices to end up having continuous suctioning of your patient, it may behoove you and allow you to get the patient intubated a little bit more easily than certainly if the patient was lying in a lateral recumbent position, just so that they don't aspirate on their own vomitus. So the salad technique, it can be performed with a Yonker. However, the DuCanto, and it's named after Dr. DuCanto, catheter, it moves more fluid quicker. This video will not play in this setting, but if you can think about the standard suction tubing having a 3/16 internal diameter, and the DuCanto catheter has a 9/32. And then if you look at the Yonker, and I know this does not seem all that significant, but the Yonker internal diameter is 1/4 of an inch, and the DuCanto is 0.26, so just slightly bigger. But this goes back to something called Poiseuille's law, that the radius basically is an exponential factor. So that 0.1 that the DuCanto offers will allow so much more fluid to be removed. And that's why they recommend, as far as the salad technique, and again, this is one of those gee whiz, there's a new device out there, we all need to rush out and buy it. I'm not suggesting that. I think you can do it safely and efficiently with the Yonker. It's just going to take a little bit longer for you to get the patient suctioned out. And depending on what the situation is, if you have a patient that has an esophageal varices or something like that, then clearly you're going to want to be able to get them suctioned out more readily and more quickly. So any port in the storm would be beneficial to you and then ultimately to your patient. The DuCanto provides immediate and continuous suction, and there is no thumb port. We know on the Yonker, a lot of times there is a thumb port, but some of them are manufactured without the thumb port as well. So just be familiar with the equipment that you guys are carrying, in hopes that you never need to use it. But if you do, you can use it quickly and efficiently to get your patient suctioned out so that you can get to your end goal of getting your patient intubated successfully. All right, so if you have any questions about that, I'm happy to answer it. Otherwise, you can look up the salad technique and look up Dr. DuCanto and do your own research to determine if that's something that you think would be interesting. You're probably going to be able to find this video on YouTube, in which case you can watch it. All this is, the video is showing the generic suction catheter versus the DuCanto catheter and how quickly you can get the patient suctioned out. And it's basically half the amount of time. If you're looking at the glass on the right, I'm sorry, on the left, it's 12 seconds. And if you're looking at the DuCanto catheter kit, it's half the amount of time. You're down to 6 seconds to suction out the same amount of fluid. So again, you're able to find this on YouTube and you guys can watch those videos.